I'm Todd Neal at the American Stroke Association meeting, talking with Dr. Jeffrey Saber on cooling in treatment of stroke. Dr. Saber, can you talk a little bit about the thought behind using NSAIDs in cooling for the treatment of stroke?
Sure. The challenge with cooling to protect the brain is the body tries to return to the normal set point. It will induce shivering and other mechanisms to re-warm, and those need to be overcome. The NSAIDs provide a pharmacologic mechanism to allow cooling to be maintained when, through surface cooling techniques or other techniques, it is induced.
Can you talk a little bit about the Japanese study and how it differs from past studies?
Yes, there are three general strategies of cooling. There's advanced severe cooling, getting the body temperature below 32 degrees centigrade. That requires that you paralyze the musculature to prevent shivering, which means you have to intubate the patient. That provides profound protection, but is a major undertaking and has potential side effects. The second stage that has begun to be widely investigated is mild to moderate hypothermia, getting the body down to 33 to 35 degrees centigrade. But that requires giving drugs that suppress shivering, like meperidine and magnesium, and can be uncomfortable for the patient. The Japanese group has pioneered with this study a very mild hypothermia approach in which simple surface cooling and nonsteroidal anti-inflammatories brought the temperature down to around 36 degrees centigrade, which is an approach that has the potential to be very generalizable, widely applicable, and useful in milder stroke patients in whom the more advanced hypothermia techniques might be risky.
Now, what damage can be done to the body from hypothermia?
The potential side effects of hypothermia include changes in the clotting system so that you can get both thrombotic or bleeding complications. You can get an increased susceptibility to infection, which stroke patients are already prone to, so pneumonia and other infections are major complications. There are other metabolic abnormalities that can also be caused.
Is this cooling feasible for widespread use?
This type of treatment is very feasible, widespread. The Japanese study used a particular nonsteroidal anti-inflammatory medication that's available in Japan but not in the U.S. But others, acetaminophen works in the same direction, although not quite as powerfully. Ibuprofen might give nearly the same benefit. So widely available nonsteroidal anti-inflammatory medicines and simple ice cooling on the surface are both techniques that are widely available.
Thank you, Doctor. I'm Todd Neal, MedPage Today.